Hello friends, today we will discuss next practice test for nursing officer CHO staff nurse. Question 1. Acetaminophen paracetamol antidote is insulin, flumazenil, acetylcysteine, tramadol. Let us see the correct answer of this question. The correct answer is option C. Acetylcysteine is antidote of acetaminophen. The correct antidote for acetaminophen overdose is acetylcysteine. Acetylcysteine is used as an antidote for acetaminophen poisoning. Acetaminophen overdose can cause liver damage, and acetylcysteine helps to prevent or reduce liver injury by replenishing glutathione, a substance in the body that helps detoxify acetaminophen. Next, warfarin antidote is flumazenil, vitamin K, naloxone, adrenaline. So the correct answer is option B. Vitamin K is antidote of warfarin. The correct antidote for warfarin overdose or excessive anticoagulant effect is vitamin K. Warfarin is an anticoagulant medication used to prevent blood clotting in cases of warfarin overdose or when there is an excessive anticoagulant effect. Vitamin K is administered as an antidote. Vitamin K helps in the synthesis of clotting factors in the liver, thereby reversing the anticoagulant effect of warfarin. Infectious mononucleosis is caused by which of the following? Cytomegalovirus, beta hemolytic streptococcus, Epstein-Barr virus, herpes simplex virus. The correct answer is option C. Epstein-Barr virus is caused by infectious mononucleosis is caused by Epstein-Barr virus. Infectious mononucleosis, commonly known as mono or glandular fever, is primarily caused by the Epstein-Barr virus. EBV is a member of herpes virus family and is the most common cause of infectious mononucleosis. Next question. The nurse is going for a client who is thought to have pernicious anemia. What signs and symptoms would the nurse expect in this person? Easy bruising, beefy red tongue, fine red rash on extremities, pruritus. So let us see the correct answer. Option B is correct, beefy red tongue. The nurse would expect to see a beefy red tongue in a person with pernicious anemia. Pernicious anemia is a type of anemia that occurs due to deficiency of vitamin B12, which is essential for the production of healthy RBCs. The lack of vitamin B12 affects the normal development of RBCs, leading to anemia. Next question. The nurse is to administer an IM injection to a 6-month-old child. What is the most appropriate site to use? Option 1. Vastus lateralis, dorsal gluteal, ventral gluteal, iliac crest. So the correct answer is option A. Vastus lateralis is the correct site. For an intramuscular IM injection in a 6-month-old child, the most appropriate site of use is vastus lateralis muscle. The vastus lateralis muscle is located on the anterior lateral aspects of the thigh and is commonly used for IM injection in infants and young children. Next, the nurse is to administer a tuberculin skin test. What is the correct procedure? Give it subcutaneously in the inner aspect of forearm. Use a 21 gauge needle and administer in the forearm. Give it at a 10-degree angle in the volar surface area of the arm. Administer it intradermally in the upper arm. Let us see the correct answer. the nurse is to administer a tuberculin in the upper arm. So the correct answer is option D, administer it intradermally in the upper arm. Let us see explanation of this question. The correct procedure for administering a tuberculin skin test, also known as Montague's test, is to administer it intradermally in the upper arm. Next question. Which of the following condition can cause a hiatal hernia? Increased intrathoracic pressure, weakness of the esophageal muscle, increased esophageal muscle pressure, weakness of the diaphragmatic muscle. So the correct answer is option D, weakness of the diaphragmatic muscle. A hiatal hernia is primarily caused by weakness of the diaphragmatic muscle. The diaphragm is a large muscle that separates the chest cavity from the abdominal cavity. Next question. The pathognomic sign of measles is Koplik's spot. You may see Koplik's spot by inspecting the nasal mucosa, buccal mucosa, skin on the abdomen, skin on the antecubital surface. So the correct answer is option B, buccal mucosa. Let us see explanation. Koplik's spot, which are considered a pathognomic sign of measles, can be observed by inspecting the buccal inner cheek mucosa. Koplik's spots are small, white or bluish white spots that typically appear on the buccal mucosa opposite to the premolar teeth. Next question.